Welcome to Tree of Life Connection, where we connect people's lives to real issues. Welcome. Today we are actually talking about Your Teeth Matters. And today we have Dr. Keisha Alexander, who is an orthodontist and the CEO at Smile Concepts Orthodontics in Apopka, Florida. Welcome, Dr. Alexander.
Thank you. Thanks for having me.
So, people are very interested in their teeth. That's probably one thing that people, when they smile, when they eat, there's just so many things that happen with the teeth. And I just want to hear a little bit about, what is orthodontics?
So orthodontists are dentists who specialize in diagnosing and preventing, intercepting, and treating dental and facial irregularities. These problems include teeth that are crowded, that are spaced, that may stick out, they may not meet in the jaws together, they may have some abnormalities where that's concerned. So we treat all these problems. We can identify their problems, we try to find ways to solve these problems and try to help the developing dentition to guide it into the right functionality so that as the patient grows, everything fits well and they're able to chew and eat their food properly.
So you mentioned about the teeth sometimes are misaligned. When is really a good time for people to start going to an orthodontist?
That's a great question. So one of the things that the American Association of Orthodontists or national organization recommends is that every child by age 7 years old receives an orthodontic evaluation by an orthodontist where we're able to evaluate the teeth to see whether or not the developing dentition has any problems that needs to be addressed before the patient has grown too much and some of those things become more difficult to correct, or can also guide the growth of their jaws and the erupting dentition well as well.
So you mentioned by the age of 7 that really a child should go to the orthodontist. Now, it sounds like that is different from going to the dentist for like a cleaning, or is it about the same?
No, it's different. So when you go to the dentist, you get your teeth cleaned, you get an evaluation with certain x-rays that are different from our x-rays. When you come to the orthodontist, we take 2 specific x-rays that evaluate the way the jaws are growing and the way the teeth are coming in. So when we do that, we're able to determine if there's anything that's coming in abnormally that we need to address early. So for example, patients that have cross bites, if they have in the front or the back of their teeth, or if they have some kind of a thumb habit, finger habit, where they suck their thumbs or they suck their tongue, all these things can affect the way the jaws grow. So we try to address those concerns earlier rather than later. Now, many times you'll come in for a consultation or an exam, and when we evaluate, if there's nothing that we need to do now, we just keep you on observation. We put you in an observation program, and we just bring you back every 6 months to evaluate as things continue to erupt to make sure everything is safe.
Great. So if a parent wants to bring in their child, let's say at the age of 7, what should they expect during the first visit?
So our first consultation is complimentary. We do not charge you just to come in. We take 2 x-rays of your teeth. The one that I mentioned before that shows the eruption of the teeth is called a panoramic x-ray. We take a cephalometric x-ray, which shows the jaws and how they're growing. And with that x-ray, we're able to determine if there's anything that needs to be addressed early rather than later. And then we also, if you were to start treatment, once you have done your health history questionnaire, we've gone through that with you, and mom or dad or parent or person has accepted the treatment plan and diagnosis, then we will proceed with photographs, where we take pictures of your face, we take pictures of your teeth, we take moldings of your teeth or a scan, and then we start the process of moving your teeth. Of course, it could be, we can use either braces, because in orthodontic treatment, we have 2 major categories of how we move teeth. We move teeth using either removable appliances, or that's like the clear aligner therapy, or we do it using fixed appliances. That's the actual brackets that we glue to your teeth. The brackets can be glued externally, meaning on the surface of your teeth that's close to your lips. So that's what we call the labial surface. Or we can glue the brackets to the surface close to your tongue. That's called the lingual brackets. That's lingual orthodontics. And for the brackets themselves, we have so many different types. We have clear braces, we have metal braces, we have gold braces. The choice is yours. We have a combination of the both or the 2. We even have a lighter colored metal braces. And they all can put colors, whatever you'd like, we have it to offer.
So how is it determined how long the braces need to be on for?
So every single case is different. So that's why when you come for your complimentary exam, we're able to, at the end of the consultation, at the conclusion of that conversation, we will determine exactly how much time is needed. Some patients may need, the average treatment time is 2 years, but depend if you are, let's say, a 7-year-old and you might need a thumb habit appliance, it takes 6 months to break a habit. So we usually have you wear the appliance for 6 months, and we hold, just kind of watch you. So we may say you need a treatment plan for a year. If you're an adult looking for clear aligner therapy and it's not very much, maybe you had braces before and you came back for a second round of treatment because something relapsed or moved, that may be 6 months. If you've never had braces ever or orthodontic tooth movement at all, that may be a year and a half. It just depends. When you come and we do the evaluation, then we can give you a fair assessment and an accurate time so that you will know exactly how long it will take to complete your treatment.
So I've heard of people having wisdom teeth that need to be removed. Now, how does that play into with braces and just orthodontic treatments?
So everyone is different. Most patients will usually need to have their wisdom teeth removed at some point. Sometimes some orthodontists will ask you to remove them. At the exam, we tell you this as well. We may ask you to have them removed before starting treatment, depending on their position and how they're developing and the age of the patient. But many times we can ask you to have them removed after treatment. And then there are times when the wisdom teeth are affecting the eruption of the second molar. So the wisdom teeth are really, in the real term is called the third molars. So the third molars in all 4 quadrants, if they're present, sometimes they're coming in and they're blocking the eruption of the second molars, which come in at age 12, around about age 12. So if that's the case, then we will usually ask you to remove them earlier than later. It just depends, again, on the patient and the doctor's opinion. And there are some oral surgeons who they prefer to remove the wisdom teeth when they're a little bit further along in development, so they have some sort of roots on them developed, not just when they're only small in their follicular stages. So again, that's the decision of the orthodontist and the surgeon combined.
So I know that when they have braces on, how is the oral hygiene different with and without braces, or is it the same?
So the same process of taking care of your teeth before braces is going to be the same process when you have braces. It's just a little bit more intense, and you really have to be even more meticulous about your hygiene, because there are these things called white spots that form on the teeth when you do not take care of your teeth when you have braces on. Particularly patients who have the brackets and they don't brush around the gum area, between the gum area and the brackets, there's a lot of accumulation of plaque and bacteria. It's very common to see that form there. So if you brush really well, regularly in the way that we ask you, using what we call the BASS technique, that is the proper way to brush your teeth, with an angulation of 45 degrees of your toothbrush towards your gum tissue, and you make your small circles in a downward motion on the upper arch and in an upward motion on the lower arch, then you should have no problem when you're in treatment. But you have to floss, brush, and rinse, just like whether you had braces or not. It's really important when you have braces, but you really have to do that. It's very, very important.
So are there certain products that are more recommended for the brushing and the flossing and the rinsing?
So the bottom line is, once they have the American Dental Association seal of approval, that it's going to be fine. And there are some patients who don't believe in fluoride. If you're okay with fluoride, it is the preference to use a treatment, a toothpaste or a product that has it, so that you will help to strengthen the enamel and prevent any acid attack and decay from forming from the bacteria eating the food that accumulates on your teeth. So, I mean, it technically doesn't matter which one. It just, as long as it is approved by the American Dental Association, you will see that seal on that product. So whether it's Colgate or Crest, it doesn't matter.
So it sounds like you treat adult patients as well as pediatrics.
Yeah.
Is that correct?
Yes, we treat patients of all ages. I've had patients from ages 6 all the way up to 84.
Wow.
Mm-hmm.
So in like any closing remarks about really, because we've talked about your teeth matters and why it is so important to have really, strong teeth and healthy teeth and a healthy mouth. Just kind of give us some, kind of summarize what you kind of share with us today.
So basically, a big portion of our dental health is connected to, and our oral health is connected to our heart health. So the same blood vessels that run through your mouth, because every single tooth in your mouth actually has blood vessels. That's what nourishes. Unless you've had a root canal or the tooth removed, every tooth is nourished with blood vessels and nerves. So those same blood vessels are divisions of the entire circulatory system that links right back to your heart. So if you do not take care of your teeth and you develop gum disease and periodontal disease, there are studies that are being done now that show that there is a strong link between periodontal disease and heart disease. So you have to take care of your periodontium. Your brushing and flossing are extremely important. Once you take good care of them, you take care of every single tooth that you want to keep. Because if you don't take care of them, you can lose them. With or without braces, it's all important.
Wow. So it sounds like that if you don't have really taken care of your teeth, that there are actually other diseases that are linked to that.
Oh,
There's a
yeah.
disease, like you mentioned, heart disease, and actually
Yeah.
even tooth loss could actually be, again, that's not a disease, but certainly for aesthetics, that actually could be, for individuals, could make a difference, particularly just when we smile, if there's a
Yeah.
new tooth.
Yes, so having your teeth, they affect the way you speak, how you socialize, how you chew. The entire mastication and digestion process starts from when you're chewing. So if you're not able to have your teeth, you cannot break your food down properly from from the very beginning. So your teeth are a very important part of your attire, your smile, your daily presence, and your confidence.
Sure, exactly. Well, thank you, Dr. Alexander, for actually sharing information about how our teeth really matter. And what I'd like to do is I would love to actually have you come back on and talk about the link between your caring for your teeth and heart disease. I've also heard there's a link between caring for your teeth and sometimes GI problems. So maybe we can have further discussion about that in a future segment. But I want to thank you for your time today. I would love to hear, where are you located? Where's your office located?
So our office is located at 551 North Park Avenue, Suite A in Apopka, Florida, right next to the Apopka Post Office, right across the street from Dream Lake Elementary School.
So is there a phone number if someone's interested in contacting
Oh,
you?
sure. Yes. So it's 407-703-8330. And our website is www.smileconceptsortho.com. Or you can always email us if you have any questions, if you have any children who are looking to become a dentist or an orthodontist. I enjoy mentorship and mentoring young people, so I do that all the time. We have actually throughout the year, we link with many of the schools in the community, even Fleece, and also Apopka Middle School and Wolf Lake Elementary and Wolf Lake Middle School. And we have students that come through our office, and we're able to show them exactly what we do and how the process works and so on. Or you can send us an email at admin@smileconceptsortho.com.
So it sounds like you're very open to letting young people come in and just see exactly what you do if they're kind of in the decision-making process about.
Absolutely. I think that's very important. It's a big part of my ministry and what I do, what I enjoy doing.
Wonderful. Well, thank you for opening up that. And I really hope you enjoyed our program today, talking about Your Teeth Matters. We are very concerned about not only your mind and your body, but also your spirit as well. So taking care of your teeth is part of taking care of God's temple.
That's right. Oh, you're so welcome. It's my pleasure. Thank you.